city is fluoridating it. The fluoride that we fluoridate the water with is a toxic byproduct of the fertilizer industry. And as far as I can tell, it's basically really behaving as a poison to a lot of people. Anybody with any kind of kidney impairment is going to have more difficulty if there's fluoride in the water, and they'll have to remove the fluoride.
There's a lawsuit against Nestle and Gerber Foods. The parents of a 13-year-old girl has fluorosis, and 90% of the water that she drank from birth to age 13 or age 8 was from Nestle's, and was touted as being good for the teeth because it had fluoride. And the fluoride content was 0.8 parts per million, and Austin's is 0.7 parts per million. And she has fluorosis. I'll give you the pictures afterwards. I have her teeth. They're suing for damages and for replacement of veneers and for replacement throughout her lifetime 5 or 6 times, and for pain and suffering. So I think it would be, since this lawsuit has set precedents, I think it would be very wise for the council to approve a warning on the water label about the water, writing the water.
There's scientific evidence, poison to the kidneys, as you've heard, and of course you already know about the warnings that have been given in terms of causing fluorosis. There's also many people who are living in communities who are ingesting the fluoride at a level that is on par with what doctors use to reduce thyroid problems where they have hyperthyroid patients. This reduction contributes to hypothyroidism, which is underactive thyroids. And the symptoms for that are obesity, water
is a very toxic substance. And one of the points I want to make here is the fact that this compound, hydrofluorosilicic acid, is not naturally occurring, and it's much more toxic than lead. You know, we put lead in gasoline for 50 years until we found out that it causes brain damage and retardation and lower IQs in children. So we took it out, and lead levels fell dramatically. But this compound that the city's adding is actually many times more toxic than lead. It's nearly as toxic as arsenic. So why would you put something that harmful in the water supply? Actually, a number of years ago, the Environmental Protection Agency was asked if there were any health studies on the silicofluorides. That's what this hydrofluorosilicic acid is. And EPA wrote back a letter and said, we have no health studies on this specific group of chemicals called silicofluorides. So when you're talking about risk to infants, there is a risk because this is such a highly toxic substance. It's highly reactive. And also there's evidence that when it's in the water, it encourages the leaching of lead from plumbing systems to go into the water supply. So children get increased lead exposure from the presence of the fluoride in the water. There's actually so.
We need melatonin, adequate deep sleep, to produce growth hormone. This is our repair hormone. I see so many kids on prescription growth hormone therapy due to small or short stature. Is this related? I commonly see kids with abnormal chromosomes, damaged DNA, and a myriad of health problems. I agree that the risk of serious chromosome damage is enhanced even in fluoride doses determined to be safe for drinking water by the Public Health Service.
I've been hearing so many of my friends that come down here and talk to y'all, and they would say, well, they were just reading things and turning their heads doing other things and laughing when they had doctors talking about how bad this is. And it made me angry that you ignore us. How much are they paying you to continue to poison us?
Yeah.
It's obvious somebody is getting a lot of money to be keeping on and causing all of these thyroid. Look at me, I'm fat, and it's probably because it's ruining my thyroid, causing sugar diabetes. so when I go out and eat, I can't get rid of it. I carry my own water in so that I can have non-fluoridated water. I don't understand why you're so hard to get through to you. What do we have to do? There are people outside, and they're mad about a lot of things. The government's decided to turn their face, hear nothing, see nothing, and keep on doing whatever they want to do. And we're tired of it. We want action. Stop coddling poisoned people. They want to kill us. And stop coddling it. Because we're mad. Please.
What was your name, ma'am?
Janice.
Janice what?
Livermore.
Thank you, Janice.
It's hard because there's so much conflicting information. You're being told by the federal government, by the CDC, what a great thing this is. You're being told by the American Dental Association and by the medical associations how wonderful this stuff is. But I want to ask one question. They went back and said, you know what, gosh, the levels at 1.2 ppm, we were wrong for decades. We're now going to put it at 0.7. Randy Shade asked the absolute best question when we had the debate with Dr. Conant and the Fort Stockton doctors that came. And she asked them, 0.7, how do they come up with this? How did the CDC come up with this? She asked Dr. Wong this. The response was not, here's the data. The response was, this is what they thought was best. That is very alarming. So if I were you,
Fluoride-free Austin, that is the duty of our mayor and city council to immediately vote to put a warning label on all water bills, given the past 3 years of presenting irrefutable scientific evidence to our city council via citizens communications, videos, documents such as the recent Mosaic Company's MSDS sheet warning itself, as well as Fluoride-free Austin's resolution, which we're passing around to companies. We've given you various forms of damage cited by the CDC, the NRC, the FDA. It's like the lady was saying, how much evidence do we need for y'all to take action? And then there is the actual warning. In January 2011, the CDC lowered the maximum level of fluoride recommended from tap water from 1.2 parts per million to 0.7 parts per million. One lady said, well, fluoride was used in rat poison, so if this much rat poison is bad for you, then how is half that much rat poison good for you? And on the warning label, it's
clear through many studies by obviously top-level doctors and toxicologists that fluorosilicic acid is a dangerous compound and one that is absolutely not necessary for our water. There is no reason why fluorosilicic acid should be added to my water. It has been proven to cause dental fluorosis in children and adolescents, as well as other ailments. A professor from the Ivy League school, Dartmouth University, Dr. Roger Masters, has determined the inherent danger of water fluoridation. The results from his study of New York school children from 1994 to 1998 showed that fluorosilicic acid did not only help dental hygiene, but is linked to higher levels of lead in children. In addition, Dr. Masters investigated how the levels of lead put into the brain can alter brain chemistry and harm individuals. Dr. Masters asked, shouldn't we stop intentionally exposing 140 million Americans to an untested chemical until the risks are extensively and objectively evaluated by independent researchers? The fact that doctors from the highest respected universities of the world have concluded water fluoridation is not safe proves there is a real danger and a real health risk that must be investigated and acted upon immediately in order to protect the citizens of Austin, Texas.
People who want tobacco, only the people who want tobacco have to pay to purchase it. Everyone is obliged to pay for fluoridated city water through taxes, and those who don't drink it pay a second time for a supply of purified water if they can afford it. Both tobacco and fluoride are slow-acting cumulative poisons. One puff won't hurt you. One glass won't hurt you. Tobacco stains the teeth of adults. Fluoride stains the teeth of infants and children. Tobacco lesions that show in x-rays as spots on the lungs. Fluoride, over time, produces the kind of bone damage that doesn't show up in x-rays. Dental fluorosis is the outward sign of what's going on invisibly with your bones inside. So, committee, please do the right thing. I have confidence that a city with funds to throw around on projects like that can come up with the money for some extra ink. Thank you.
7.1% diabetics, 10.1% of the population kidney disease, 6.9% hypothyroidism, and 7.2% children age 5 and below. That's 34.1% of the population. The government admits we are endangering with this health practice. It is your civic and moral duty to warn every citizen of Austin as quickly as possible, and a warning on the water utility bill is a cheap way to do that. Please warn those at-risk populations so parents and citizens can make an informed decision about what they put into their own bodies. Thank you.
Of our infants and our children. 25 studies now confirm that fluoride lowers the IQ of children. Who would have thought that this Austin City Council would maintain a program that actually lowers the IQ of the children of Austin? Who would have thought that? When are you going to stop it? Please stop.
What's happened now is because of the material safety data sheet, the Mosaic company is the major supplier in the country for this hydrofluorosilicic acid that Dr. Carmen was talking about. This morning, they added to their material safety data sheet only in May. So right now, there are other cities across the country that are doing the same thing. People coming to their city councils requesting a warning. But no one, I don't know of anybody that has done it yet. And actually, they have now transferred the legal liability onto the city of Austin. They've pretty much washed their hands. Once they warn you, they are not liable for being sued. So that's really probably the reason that they put it on, because of all the lawsuits that are happening right now. Okay, good question. Thank you.
Acceptable, and this is why there needs to be a warning label on the city's water that infants and young children should not be drinking this water because it's a lifetime effect. If you have a lower IQ, we don't know how to reverse that effect. So, and as you've already heard from Carol Vanderstoep, we retain a significant amount of the fluoride. The kidneys only take out about 50%. So you need to look at, what you're doing. You need to protect the infants in Austin and put this warning on the water bill. Thank you.
Councilmember Riley. Dr. Cummings, can I ask you just a question or two?
Is kidding themselves, because I guarantee you're not in the big club, and you'll not be spared if you support their evil path. Your little bit of extra money, and I don't know where the money is coming from, but I do believe in following the money. But that little bit of extra money won't guarantee anyone's safety. As the first woman who spoke said, we are all in this together. And as for me, I prefer to die for what is right than to live as a pathetic coward and not speak up. So I urge you to do the right thing for the people.
Thank you, Ms. Sutton.
And the people, my friends, includes everyone in this room. We need to get fluoride out of our water. So thank you so much for taking firm action.